a lot of their issues are not being addressed. In a time where so many people are lacking, there has not been a roll out of any programs seeking to look at the welfare of the individuals in and around the community. And presently, I think that we need to put some pressure on the government to recognize that there are persons within the community, you know, that have to get this representation as it is a us right now.
What would you say is the most pressing issue or the recurring?
The most pressing issue right now is crime and violence amongst our youth. I think for me, we as a branch have sat down and put our heads together, and we've decided that a mental health meetup is the first program that we're wanting to roll out. We're in the process of adopting St George Secondary School, where I as a candidate will reach out to the PTA and, using my training in psychology and intervention, begin to put programs in place to target at-risk youth within the community to see if we could curb young offenses and young offenders before they get into the system. I think that a lot of our children in the school setup have been, you know, pushed to a side, and without the face-to-face contact and the mentoring and the counseling that they're accustomed to in schools, we have a duty, not just as a party but as a people, to ensure that our young people are looked after in that respect. So mental health is definitely priority on my agenda for the community, and I do not think that there has been enough done over the last 2, soon to be 3 years for this community presently and for Barbados with respect to mental health. I think I'd now call on the Ministry of Health and Wellness to begin to look and to see how or who are the trained psychologists within the country, within the community, that can begin to get out there the same way that there are pop-up shops and pop-up drive-thrus for testing, COVID testing, and for vaccination. I do think that we need some pop-ups and drive-thrus where people could get their first-hand mental health first aid and the interventions right now that people really need to cope in the times that we're living in.
I know that you are talking about mental health. How are people coping? What are they, they're turning to? I don't know if they have shared that information.
Their mechanism is worry. And as I could tell you, worry at this present time does nothing. You know, worry doesn't pay bills, worry doesn't change the circumstances. All worry does is make you ill, not just mentally but physically as well. And I think that in my efforts in canvassing the community, I have used my skills and my expertise to provide, you know, that quick 10-second intervention. First things first, people just want to know that you care, so you ask people how they're doing, and you know, they begin to open up and to share the stories, and then I ask them about the things that they do in order to, you know, to cope with these challenges. And I throw 1 or 2 ideas out there, and I always leave my number so that if at any time they feel as if they want to get back in touch and continue dialogue, I believe that I have a right to be here for people, and I want people to know that I'm here for them.
What do you say the next step?
The next step for me really is to move our mental health meetup from the community to make it more national. We're looking to see if we can pilot it throughout the constituencies, and once we get a feel for the pilot on the ground, then we as a party intend to roll out a national mental health program at this time in order to see how we can support people. You know, people talk about finances, and finances are important, but understand that the lack of finances brings worry and it brings stress, and you can't expect people to be physically healthy, you know, if they're not mentally well and focused in order to accomplish this.
Found with this cadre of young candidates is that they are thinking outside of the box. They are coming up with solutions to the issues that they're meeting on the doorstep. And this is one of those initiatives which is in direct response to what Don Marie has been meeting on the doorstep. That is to say, people who have found that their incomes are challenged, that their abilities to support their families reduced, and that at a time like this, at Christmas, when there is almost the expectation that there will be provision of certain kinds, certainly in terms of meals, that they are not able to meet that requirement. And I am happy and I am pleased that so many of the other candidates are also here supporting the initiative. It is a walkthrough, not a drive-through, a walkthrough, so I'm pretty sure that others will come through as well. But these are the types of initiatives, these are the solutions to problems that the Democratic Labour Party is happy to be facing with. coming into this season, and also in terms of how we face the electorate going forward. Because at the end of the day, our job is to represent people and to find solutions to their issues, whether they're small issues or big issues. And this, as far as we are concerned, mental health and the ability to provide for family is a very big issue in the country at present.